legislature.
Thanks for watching TMA's Legislative News Hotline for Friday, March 6th. I'm Brent Anier. It's time to improve ImmTrac to better help patients. That was the gist of the message Austin pediatrician Dr. Kim Avila Edwards told the House Public Health Committee this week. She testified in support of House Bill 465 by Representative Donna Howard and Dr. Representative J.D. Sheffield, a TMA member. The bill would, among other changes, make the state's immunization registry, ImmTrac, an opt-out system.
I use and depend on ImmTrac on a daily basis. Moving to an opt-out system of consent means that I can advise my families that their immunizations and vaccine information is going to be entered into ImmTrac unless they specifically choose not to participate.
Here's how doctors believe the bill would improve ImmTrac. It would allow people the freedom to opt out of the state immunization registry, give physicians and vaccine providers the info they need to make sure Texas children are vaccinated against deadly vaccine-preventable diseases, and better records would help ensure children aren't unnecessarily over-vaccinated, make it easy and convenient for families to maintain accurate vaccination records for children and adults, preserve vital records for use in responding to a public health emergency, and provide better records for people preparing for college or employment.
What I shared with them was the importance of ImmTrac in keeping children healthy, its role in keeping children safe, and the improvement that we could have in terms of making the immunization registry robust if it went from an opt-in to an opt-out system. I shared the administrative burden that would decrease, the decreased cost, the increased resources we could really shift to other areas of patient care, and I shared how if we adopt House Bill 465, as children transition to adults, that their immunizations records would be kept and again facilitate that information for them as they become adults and go to jobs that might need documentation of their childhood immunizations, or even things like enrolling in college, having that information easily accessible.
We'll track the bill's progress for you. We all remember when Ebola came to America and struck in Dallas. Now a new bill sponsored by Senator Charles Schwertner from Georgetown, a TMA physician member, aims to improve Texas's emergency response for infectious disease outbreaks. Dr. Donald Murphey, a member of TMA's Committee on Infectious Diseases and Medical Director of Infectious Diseases at Cook Children's Healthcare System in Fort Worth, testified in favor of the measure, Senate Bill 538, this week. The Senate Health and Human Services Committee, who heard testimony on the bill, also applauded former Texas Department of State Health Services Commissioner Dr. David Lakey and his team for their outstanding work during the Ebola crisis. Tuesday was not a pretty day to walk to the state capitol, but more than 200 TMA member physicians, medical students, and TMA Alliance members came out for the second TMA First Tuesdays at the Capitol this session to visit with lawmakers about top legislative topics. This group from Dallas County Medical Society packed the office of Senator Bob Hall. Doctors on Tuesday discussed several issues like more funding for graduate medical education, women's health services and mental health services, and preventing allied health professionals from expanding their scope of practice beyond their education, training, and skills. That's all for now. I'm Brent Anier with TMA. Please join us again next time for TMA's Legislative News Hotline.